What have I got for you today in this crazy COVID-19 time? What could it be? Well, I'm just keeping you company, you know? Good news and Camel spin is also about perspective. So first off, how do we reassure if we don't know what we're worried about? What are we worried about here, huh? Death, the economy, overloading the health system. Wait, what was that one? You don't want to see my teeth? Health system overload. That's the one. Death is also a big one. Try to avoid that. So what can we do about it? And how can we see the results of our crazy stay-at-home actions? A lot of the time I hear about infection, like who's all getting infected, how many infections do we have in which country, which countries have stopped infection, slowed infection, whatever. But this crazy stealth virus, we don't know where it is. Is it here? Do you have it? Do you have it? You? No? But we do know who was in the hospital, who was in intensive care, and sort of how much room is left. I say sort of because Corona's not the only thing out there, and yeah, you never know. You want to keep some room in there in case something happens. Some other disease. Oh my gosh. So today I'm going to focus on the city of Berlin in Germany because they've got some great data about hospitals and stuff that I can share with you. And their Chancellor Merkel just gave a great explanation about what she's tracking in terms of the infection rate or what's going on there. I've got the links to the Berlin data in German and Merkel's little explanation translated to English down below. Okay, little history of COVID-19 in Berlin, Germany. They had their first case on March 1st. 2 weeks later, they had 283 cases with 16 people in the hospital. And 2 days after that, they went into lockdown. So the schools closed, everybody stayed home except for the most essential services. Except for the most essential services, say that 20 times fast. Wow! You think, what kind of infection rate is that? In 2 weeks, they went from 1 to 283. That's fine. But 2 days later, they had 383. They got 100 more in just 2 days. And that's when the lockdown started. So good call on the lockdown, right? Now, one thing about everything we do to do with any kind of disease business with this COVID thing, I guess we have to wait a week or two to see the results of what we did. So if we look at the graph now and it's been flat for 3 weeks, then we can reckon that we're doing the right stuff. And good news, Berlin, they're doing the right stuff. Look at this. The blue line includes all infections, people who are okay, people who are sick, people who, didn't make it. The green line is specifically people who have had the virus and now they've recovered. And that means they've been isolated for more than 2 weeks, have no symptoms, and so they're considered okay. It doesn't necessarily mean they don't have the virus anymore, but we're all locked down anyway, so we should be safe. So 2 weeks after the schools closed and everybody locked down, Berlin had 10 times as many cases. They went from 383 cases, those are the ones that are confirmed, up to 2,777 cases. But 2 weeks after that, it had not even doubled. It had gone up to 4,736 cases, 60% of which had already gotten better. So that all looks pretty good, but how are the hospitals doing? The number of people actually in the hospital seems to be flat. The number of people in the ICU is still subtly rising in Berlin, so there's no reason to relax. ICU means intensive care unit, if that's not clear to everybody. So on the 16th of April, Chancellor Merkel announced that Germany had had a kind of interim success, a fragile, thin ice kind of success. And to explain that, she mentioned a thing she called an infection factor. She said that Germany had reached an infection factor of 1, which means 10 people infect 10 people, which is stable. Doesn't mean the disease is going to go away, but it's not going to keep growing. So that's sort of a flat curve. So Germany's getting ready to loosen some stuff up very carefully. But she warned that if it goes up by a factor of 1.1, that's when out of 10 people, 1 of them infects 2 people. It would overload Germany's hospitals, the intensive care units, that is, by October. And if it went to 1.2, that's 2 out of 10 people infecting 2 people instead of 1, or 1 in 5, that would overload the ICUs by July. And if a third person on average out of 10 infects 1 more person, so on average 3 infect 2 and 7 infect 1 out of 10, in that case, the German ICUs, the German intensive care units, will probably be overloaded by as soon as June. So that's why what everybody's doing, what you're doing, is so important, and you can feel good because it's working. The curve is flattening. Just have to be careful to not let it go out of control as we loosen things up, and eventually it'll be all over. So just hang in there, everybody. I know you can do it. Take care out there, and I'll see you again soon. Bye-bye!